Sonia Johnson here, and thanks for joining us on the Chat Cancer podcast, the place to have open, honest and engaging conversations about cancer. We're thrilled to be collaborating with Warrington Voluntary Action and the Cheshire Merseyside Cancer Alliance to bring you insights, experiences and support around cancer care. Today we're talking about breast screenings, which enable us to detect breast cancer early and when it has the best chance of being treated. It's perhaps one of the more well-known types of cancer screenings, but one that we'll be chatting about in detail nonetheless. We're going to share what the breast screening procedure is like and explore any worries or concerns that someone might have and address any known stigmas as much as we can. So if someone listening is feeling wary about the procedure, we can hopefully put their mind at ease and make the whole thing feel as routine as possible. And that's the overall plan for this episode, to empower more people to put their health at the top of their priority list by attending these screenings, which for some can be a life-saving choice. And as per, we're keeping things fun and friendly with our brilliant live audience here at Mama's Bakery in Warrington. Welcome, everyone. And joining me in this particular episode is Sonia from Orford in Warrington. Sonia is 56 years old and coincidentally is the owner of Mama's Bakery, where we find ourselves today. Thanks so much for joining us at Chat Cancer, Sonia. We really appreciate you being here. First and foremost, can I ask what made you choose to come on the Chat Cancer podcast and why breast screenings are important to you?
Breast screening, I think, is important to me because my old career was in HR, and that was one of the biggest issues with sickness absence for female members of staff in school. Yeah. So I did quite a lot of work on it, and it is, it's something that's a little bit close to my heart, really.
So how long have you been attending your own breast screenings for?
I think, I was trying to think back, the first one I had, I was definitely under the age of 50. I'm not sure by how much, but my GP's always been really good at picking up on new initiatives. Yeah. So I know I went before the age of 50 and I've had 3 since, in the past 6 or 7 years or something like that.
Oh, brilliant. So at least we can chat through that experience and it's someone that knows what everyone's going through that's listening. Thank you, Sonia, so much. And again, welcome to our show. Before we begin, I'm going to try and summarise what breast cancer actually is, just so there's a clear understanding of what we're chatting about today. Sonia, are you happy to share any information you might have on that?
Absolutely. So breast cancer is when abnormal cells in the breast begin to grow and divide in an uncontrolled way and eventually form a growth, sometimes called a tumour. Mm-hmm. It's most commonly, it starts in cells that line the milk ducts of the breast and is the most common cancer in the UK, mainly affecting women, although it is important to mention that men can get it too. The screening uses a test called a mammogram that takes x-rays of the breasts, and this helps to find breast cancers early when they might be too small to see or feel. Yeah. And that's really important because these cancers tend to be easier to treat than the larger ones.
And although in this episode we are focused on the early detection of breast cancer when there might not even be symptoms, I will share the common symptoms, which are a new lump or swelling in your breast, chest or armpit, a change in the skin of your breast, such as dimpling, which is bumpy like orange peel, or redness, which may be harder to spot on black or brown skin, a change in the size or shape of one or both of your breasts, fluid leaking from the nipple in a woman who isn't pregnant or breastfeeding that may have blood in it, pain in the breast or armpit which does not go away, and a change in the shape or look of the nipple, such as it turning inwards or having a rash on it. Now, these symptoms can also be caused by other medical conditions, but if you're listening to this podcast and are showing any of them, please contact your GP and get it checked out as soon as possible, just to be sure. Now, Sonia, taking it back to breast screenings and trying to catch the possibility of cancer as early as we can, should we talk through the process and what it involves?
Yeah. Yes. So first of all, it's worth mentioning the NHS breast screening programme invites anyone registered with a GP as a female for breast screening every 3 years between the ages of 50 and 71. So you'll get a letter in the post inviting you. Yeah. If you're 71 or older, you won't automatically be invited, but you can still have breast screening every 3 years if you want to. You just need to contact your local breast screening service to ask for an appointment.
And it's so important to do that, isn't it?
Yeah.
So how did you receive your first breast screening invitation?
A letter in the post. It's always been a letter in the post. And I think you kind of, when you get a bit older, you get used to that. So you're used to receiving that. And I suppose it's always best to look out for it. If you don't think you've had one, or you've moved address or something like that, then is the time to ring your GP, because they always religiously send you an invite.
Yeah, that is super important to note, isn't it? Any changes in your circumstances, make sure you're letting them GPs know.
Yeah.
So when you get that invitation through the post, what does it tend to say?
You've got a screening appointment on this day in this place. I'm not. I know you can have it in a couple of different places in Warrington, but I've never been given a choice necessarily. It does say at the bottom of the letter though, if you can't make it, just to give us a bell and we'll rearrange or look at a different venue.
It is important to note, isn't it, that they can be quite flexible. It does say at the bottom it can change, so we can ring if need be. So how do you make that actual appointment? Is it just a quick phone call?
Well, you don't. They give you one. But I've just never changed mine. So I'm assuming that if you needed to, you can ring up and just rearrange it. But I've just... Because I don't want to put it off and there's a danger of doing that, I've just gone along with the one that they've sent me in the post and rearranged whatever else is happening on that day.
I suppose that takes that extra step out of it, doesn't it? You don't need to worry about that phone call. It's there, it's done.
And if you try and change something, unless you've really got to, you could be waiting a lot longer and then forget about it. So I always find it's best to stick with what you've been given if you can.
Yeah, can totally relate to that. So when you receive that invitation through the letterbox, how are you tending to feel about it? What are your immediate thoughts?
I think it's natural it's always anxious because there's a letter that's just come through your door that's got NHS on it and you don't know what it's for. And when you do get over a certain age, you're probably having other things checked at the same time. Yeah. So you're not quite sure so actually an appointment for a breast screening is it's actually more positive than it could be. So it could be results of a blood test, it could be other things that you're checking out. So actually you're always anxious when you see the letter, probably less anxious when you open it and you think, oh, it's just for a mammogram, so it's not too bad.
That's a really positive way to look at it. Yeah. So you've had your letter, the screening is already booked because they've done it for you. Win-win. Where do your screenings tend to take place? Because we have a couple of options in Warrington.
I didn't know they did them at Bath Street, so that's quite interesting. I might next time I might see if I can go there instead. But mine have always been at the Halton Hospital, so I've always gone up there, and I don't mind it up there because the parking is 10 times easier than it is at Warrington Hospital. So
But I suppose for you, Bath Street's literally around the corner, so you could literally walk there, couldn't you? Wouldn't even need to worry about that. So let's be honest, breast screenings aren't the most comfortable thing, are they?
No.
There is no avoiding it.
No, it's not.
So what happens when you first go into that room?
To be honest, I think that when you first walk in, you get past reception. That's the bit that's the most anxious because you've got to get undressed. And you actually don't know how far away the room that you're getting undressed is from where the mammogram's going to take place. And they've changed it. I've been 3 times and it's been a slightly different distance from the undressing room. And it's like, well, what do I do when I'm undressed? Do I walk in with nothing on the top? Who's going to be in there? So there's always a little bit of anxiety around that. But it's almost like stuff that you're putting in your own head because there is nobody else there other than the nurse that's doing the screening. And they're really good about it. They give you the time that you need to get changed and feel comfortable and ready and then go in and after you're undressed. So once you've done that and you get to the x-ray machine, the female mammogram, I don't know how you pronounce that, to be honest. They explain the process. So your breast is placed on the x-ray machine, pressed between 2 plastic pieces to keep it still. And I'm saying this as if it's dead straightforward because it's not. And the x-ray will take a few minutes. You need to stay still. And they don't just do it, they do it in 2 different ways. So they flatten it top to bottom and then on a tilt. So they can see the sides of your breast as well. And the same process is repeated on the other breast. And then you get, you go back and get dressed. It's not as easy as that sounds because whenever I've been, I'm slightly not tall enough for the lowest level on the machine. Because they've got there's a height adjuster, but it's limited. So I always feel like I'm stood on my tiptoes. Just so that they can, and it's really difficult to stay still, and it flipping hurts, and it hurts no matter what size breasts you've got. For different reasons. So if they're smaller, it's difficult to find something to put in there in the first place. If they're larger, they're trying to get the right bit of it in between the X-ray machines. And this had, I mean, it is, I suppose it is slightly funny. Or it would be if it wasn't so uncomfortable. But it's you just kind of have to put all of that out your mind and get on with it, really.
How quick is the whole thing?
If you think you're having 2 X-rays on each breast, and they've got to change the machine each time they do it. But they're so professional, the nurses. They're really thoughtful in the way they do everything, and they don't make you feel. You just have to kind of make a few jokes to make yourself feel comfortable along the way. But they do not make you feel uncomfortable at all. Quite the opposite, really. So it's just, it's just something that needs to be done.
So how are you feeling throughout the process?
I don't know. I probably nothing, because I try to just put everything out of my head and just do what I need to do, and then you can think about it afterwards. To be honest, so otherwise, I think there's a danger that you can get yourself a little bit too worked up. And if you do and you're anxious, you're not going to be able to keep still. So literally, big deep breaths. Let's get it done. Stop. Another big deep breath, and they'll tilt the machine. Do the next one. Stop. That's easier said than done, I know, but if that's what I'd encourage anybody to do, no matter what kind of screening they're having. Just look off into the middle distance. Do whatever needs to be done, and then once it's done, and you've done a really positive thing for your health.
And once you've been through that, and I know you've explained it is uncomfortable, but once you've been through that process and you've got your clothes back on, how are you feeling after that?
All right, because it's you're not left sore. There's nothing. You've gone. The bit of the screening is uncomfortable, but that's the only bit that's uncomfortable. And once it's done, it's done. You're back dressed. You're back to your normal life, and everything's sorted. So it's pretty straightforward after that.
So is the pain kind of very much temporary? It's in the moment, but
it's only when they're actually doing the X-ray because of the way they've got to do the X-ray. I've never felt any kind of uncomfortableness afterwards at all. So, it's just in that bit when they're doing the screening process.
Hopefully anybody listening is worrying about that pain side of thing, that'll just reassure them a little bit that it is that very fleeting.
Not painful as such, it's uncomfortable. Because it's just not a normal thing to be doing, really. So it's, I can't remember actually feeling any pain. You just feel really uncomfortable.
So once you've done that, we've done it, we're home. Obviously, the nurse will tell you about that time, won't she, when you're likely to get your results? And that tends to be in a letter in the post, which takes about 2 to 3 weeks. And most women have a perfectly normal result, and then the next screening test is in 3 years' time. Again, like cervical smears, once it's done 3 years later. You've got to worry about it again. But over the years, what kind of outcomes have you had from your screenings?
So I've never had any negative results from my screening, so I've been really lucky. And it is nice. You get your letter through the post. Oh, that's all sorted now. I don't have to worry about it for another 3 years. And you're glad that you've had it done. So I'm really lucky in that respect. But then you've got peace of mind as well for 3 years, that you don't have to worry that something might be untoward. If you didn't have the screening, you wouldn't have that peace of mind.
Exactly. It's taking control of your own health, isn't it? And putting yourself forward. Because like you say, if you hadn't have gone for it, you could spend those 3 years thinking, what if?
Yeah, absolutely. Absolutely.
So important. Thank you so much for sharing your own experiences, Sonia. It's something that's quite personal, and we're really grateful for you for being so open.
It's not a problem.
And if it helps just one person to understand the process and the advantages of attending those breast screenings, then we've done our job at Chat Cancer, because the most helpful thing is talking about it, isn't it?
Yeah, absolutely.
So when it comes to breast screenings, or any cancer screenings, in fact, understandably, there are real genuine fears and many other barriers that might stop people from going. So like the actual process, like we've just done, let's try and break some of these down so that if someone listening feels the same way, hopefully they'll know that they're not alone. And the first one might actually be a surprise for some people, but depending on what's going on in your life at the time, one of the main reasons why some people don't actually attend those breast screenings is that they just actually can't find the time. Can you relate to that in any way?
Yeah. I mean, life is hectic, and it's one of those where sometimes you'll get the invite in the post quite a bit of time before your screening is due. And if you forget, then what am I going to do about it now? Can I go and make another appointment? And I think I was going to say women, but maybe men do this as well. They worry that if it isn't a negative result, and there is some follow-up treatment, that's going to change their life. So do they really want to know that? And they'll stop themselves from going because they're worried about actually having to go through some treatment. Without actually, you've got to think through the implications of that, really, because it's going to be worse if you don't have the treatment. Particularly, I think with breast cancer screenings, because the earlier they can get it, the quicker that treatment can take place, and the quicker the issue is sorted. So best to do it as soon as possible and get in for that screening as soon as you can, really. But I can understand that that's easy for me to say. You've got to assess it as part of your own life and try and try and encourage people to build it in and just go and get it done.
Yeah, and I'm sure you're a very successful businesswoman. You've got this whole bakery to run. Trying to find that time to fit it in must be quite difficult.
No, because it's important. So I would never look at it like that, and never look at any of any health issues I've got to get checked. I know from experience of seeing what other people have gone through when they've not been for a screening or not been and got something checked, the impact on a busy person's life is far more significant than if you just go straight away and get it sorted and get it resolved. It's, so if you want to continue being successful and you want to carry on doing everything in your life, then you must go and get these things checked sooner rather than later, because putting it off and procrastinating doesn't help anybody, particularly you yourself, and it doesn't help the people around you either, because then you're going to need even more support. So, if you don't want to be a burden on anyone, go and get it done first.
That is such sound advice. I think that's great. Thank you. Looking at other barriers, one that might seem quite minor for some people, but a huge deal for others, is that feeling of embarrassment.
Yeah. And I think because of the way mammograms are done, that is perfectly understandable. If you are feeling a bit body conscious, and we all do, me included, where somebody is going to, plop your breast on a piece of plastic, it's not nice. It really isn't nice. But you've got to remember, big deep breath. That nurse has seen loads of them.
Yeah.
And, yours are no different. Well, they are different than everybody else's, but, it's just like, well, that's just another one.
Yeah.
They're not really that bothered about it. So it's just your own embarrassment that you need to get over. And I know that's easier said than done, but you kind of have to just try and work through that as much as you can. And they're okay if you want to put something on in between or anything like that. They're okay with you doing that because they want you to be as comfortable as possible. So you're dealing with NHS professionals who really know their stuff. And that in and of itself helps people feel a little bit more comfortable, I think.
Yeah, definitely. And the same way with your cervical screenings, you can request a longer appointment, can't you? So you can address those concerns at the start of it before you even have to take any of your clothes off. Yeah.
And I have never felt rushed. Never. I've never, they're not looking, well, come on, hurry up, get in from the, we've got a load of other women behind you. And the nurses I've dealt with have always been really professional and made me feel comfortable all the time. So you are going to feel a bit embarrassed.
Yeah.
But it's managed really, really well, and really professionally. So, just hold to that and hope that you're all right when you're doing it.
Yeah. And, you can take someone in with you as well. I think it's important to mention that, because you can take a friend, a family member, or even another healthcare professional at the surgery. You can take someone in, which might relieve that little bit of awkwardness.
Yeah, you can. I mean, I'm not sure I would want to. I think I'd be more embarrassing taking somebody in with me than just going in on my own, to be honest. But but we're all different, aren't we?
Yeah.
So if that makes you feel more comfortable, then you should do that, and the nurse professional will not mind that at all.
No. No. And, you know, these feelings of shame or embarrassment, they can be really heightened by like society's stigma around women's health and our bodies and things like that. But like you said before, they've probably seen hundreds of pairs of boobs that year.
Oh yeah, absolutely.
There's
Absolutely.
nothing.
You're nothing special. You're just going in there and getting it done. And it's far more important to get that screening done
Yeah.
than to worry about somebody looking at your body and thinking, oh, she could do with losing a few pounds. You know, if you know that in your own head, you don't need to be worried about anybody else
No.
thinking it.
They are great. And, you know, you can also, like we said before, choose to have it at a different place. If that particular appointment place that you've been given doesn't feel comfortable to you, or like you say, is too far away, you can't access it, you can always ask for that other place to be booked in. So such as Bath Street in Warrington, or Halton and St Helens Hospital do it as well.
Yeah.
So another common one around kind of barriers and concerns is that misinformation or lack of awareness, which is really understandable because some people might believe that they aren't even at risk of breast cancer. So if they've got like no family history, or they might be confused about what screening age they're eligible to go for these screenings for. So I guess that kind of misinformation can be really problematic for people.
Yeah, and I think people will say, I don't feel I need this.
Yeah.
I feel healthy. I think that, you know, and there's lots of information there, particularly, you know, with social media now saying, oh, well, screening causes cancer. And that can cause you to think, oh, hang on a minute, I don't want to go for that reason. And before we went on air, I had a chat with the lovely Macmillan nurse about, well, what do you do if you're under 50 and you're not being naturally invited to go for screening? But you're a little bit worried. And it's the same advice all the time. Go to your GP, get it checked out. They understand that this is something that you're worried about. They will work with you on that, and if it's appropriate, they'll send you for a mammogram. Or they'll do some other kind of ultrasound screening just to check what's going on, because if you know that there's something wrong with your body, you know, and you should get it checked out as soon as possible, really. And you know, but also, don't feel, oh, I'm thinking that because I've read something else. No, you know your own body.
Yeah.
So just any concerns, any problems, go to see your GP. If your GP isn't responding, push him.
Yes.
Because you know your body better than anybody else, and you know when there's something that doesn't feel quite right. So just get it checked out.
Yeah, definitely. And, you know, if you sat there at home and you've got that letter in front of you and you're thinking, this doesn't apply to me because I've got no symptoms, I'm fine, I'm young, it doesn't, you know, I don't feel like this fits. If you've been invited to screenings, then you're eligible for it. So please make it a priority.
Yeah.
And I suppose for people that have had them before, there is always that unavoidable experience if they've had a negative one. So if they've had a negative experience, it might cause them to not want to go to the next one. They might think, I am never going through that ever again. And it's a difficult one because, as we've said before, everyone's experiences are valid.
Yeah.
And it'd be such a tough thing to overcome that knowledge of what happened before and bring yourself to go again. If someone was to talk to you about that, because there was kind of feelings, what advice would you give them?
Well, I'd just say it's really unfortunate that they had a negative experience last time, but don't assume that that's going to happen again. It might have just been hopefully it's just a one-off. And that's been done, but please make sure you go again, because a negative experience is not as bad as missing a sign of cancer that could have been treated had you gone through that screening process. That's worse. So please just go, and we'll hear about the bad experience rather than the less eventful experiences. They are uncomfortable. It's not going to be necessarily a positive experience because they are uncomfortable. But the positivity comes from the fact that you're getting screened, and any issues that you have got, any cancer-related issues that could be detected, will be detected at that screening process and then can be dealt with. That's where the positivity comes from. So you know, it's almost, I almost want to say, don't expect it to be a pleasant experience, because it won't be. But it's an important experience. So you know, that would be my advice. And we just need to be honest about it, really. There's no point us saying, oh yeah, it's great, go and get it done, you'll come out feeling marvellous. No, you won't. but you'll have done something really, really important for your health.
Yeah.
You know, and they will make it as positive and as painless as possible because they're professional in the way that they approach it. And I know then that I don't need to worry about this for the next 3 years. So, you know, that's where the positivity comes in.
Yeah, I completely agree. And, you know, as you've mentioned earlier, these are healthcare professionals and they totally understand. So if you take that time at the start of your appointment to say, last time this happened and it was a really negative experience, they'll do what they can to make sure that that's not the same experience for you.
Yeah, they will.
It doesn't,
and they won't be like me, just rolling my eyes and going, "Oh, for God's sake, just go and get on with it." You know, because they know that is their business. They know what they're doing, and they're really, really professional about it.
Yeah.
And that, you know, I've never come across one, and maybe that's just me. That it doesn't operate like that. So, you know.
And I suppose all these kind of conversations that we're having right now tie in quite nicely to our final reason, which is the reason a lot of people are missing these breast screenings is the fear of that cancer diagnosis itself.
Yeah.
That completely reasonable and really normal thing to feel, but that small possibility that it might be bad news can actually put people off attending altogether. And I know it's a tough one to overcome, but would you have any advice for someone that might be sat in that camp right now?
I think you need to acknowledge the fear. It is normal to feel scared, and you're not alone in feeling like that.
Yeah.
Focus on the early detection. The screening helps catch issues early, so improving the treatment options and the outcomes.
Yeah.
So that is the reason to get the screening done straight away and not put it off, because if there is an issue, it's only going to get worse. So get the screening done as soon as you possibly can. Control what you can. While the result is uncertain, getting screened gives you the power to take some action, and that action is completely within your control. Lean on support. Bring someone with you. Even if you don't take them in, they can be sitting in the car park or in the cafe waiting for you and saying, right, how was that? Well done. You've had everything done. All of my friends are going through this at the same time. I've got a big friendship group. We're all more or less the same age. And that helps us because we can talk to one another about it and how we feel about it. And we can also make sure that nobody's missed for whatever reason. So lean on them for some emotional support and take it step by step. Focus on the invite that you've had come through the door, if you've had one, booking the appointment if you've not, and then take it one step at a time rather than the whole process, because that's the first bit. You don't need to worry about anything else, and you get a response relatively quickly, so they contain your anxiety as much as possible, and it's sorted quicker than you think.
That's really powerful advice. Thank you so much, Sonia. It's really important for anyone having these kind of thoughts to know that they're not alone. And hopefully someone might feel a little bit more confident about attending these breast screenings just listening to your story, because it is so important to attend them, isn't it?
Yeah, absolutely. I don't think I could emphasize it as strongly. Irrespective of the screening programs that you're being asked to attend, there is a reason for them. And if you want to be well and you want your health to stay as positive as possible, just go through the screening process and then through any treatments if that's necessary, and you'll find that the result of that is much more positive.
Yeah, exactly. It's taking control of your health, isn't it? Taking control of your life. It is so important. So unfortunately, we have now reached the end of this episode of Chat Cancer, and I just want to say a huge thank you to you, Sonia, for joining us. We're really grateful for you, and thank you very much for letting us use Mama's Bakery to record it.
That's all right.
I hope this has been a positive experience for you.
Absolutely, yeah.
Fantastic. And once again, thank you so much to our live audience here at Mama's. And we truly do hope that if you're listening and you are eligible for your breast screening, that our conversation today has encouraged you to attend your appointment or to continue attending those appointments. The NHS has recently seen the first significant increase in early diagnosis in a decade, but still over a third of women are just not taking up this potentially life-saving offer. Even if you've previously missed an appointment, you don't want to wait around for another one, make sure you're contacting your GP, because you can still book in now. And it's one of the best things you can do for your future health, and it might actually save your life. Sonia, is there anything you'd like to say that we haven't covered yet?
No, I think just keep pushing that message of early detection, really, really important. The way that cancer's treated, particularly breast cancer, it's the improvements that they have made are massive.
Yeah.
So the quicker they can get in and sort out any issues that they do find, the better your health will be long term.
Absolutely. And don't forget, if you're listening and you're showing any symptoms mentioned earlier in the podcast, please contact your GP as soon as you can. And also look at other support and information through local cervical cancer programs or cancer alliances near you. Thanks for tuning in to Chat Cancer. Please stay chatty and let's keep these important conversations going. We'll be back with another episode soon, but until then, take care, look after yourself, and don't hesitate to take action when it comes to your breast cancer screening.